Hello, everybody. Thank you so very much for this past week after I declared my candidacy for the U.S. Senate seat from Pennsylvania. We went to many places throughout this great Commonwealth, and everywhere that we went, we saw excitement for this candidacy. And everywhere we went, there were just great citizens of this Commonwealth. But I particularly want to thank you for coming to my website, for tweeting with me, and for being on my Facebook. This is truly a grassroots campaign, and that's the best kind, because it involves people, particularly people who are working families, and those in the middle class who suffered the most damage from the last 8 years. And it is for them that I got into this race, to help restore that wonderful promise of the American dream, where the working family's children always had the promise that they would have the opportunity to be better than their parents based upon their God-given talents, and to restore that broken promise that I am running. And that's why I'd like to talk just a bit about health care reform. I purposely went to a committee, the Education and Labor Committee, because I knew that the health care bill would have to come through that committee, and we passed it last month. This bill is good for Americans. It lets you stay in your private health care plan if you have one, and it'll only get better, because we are mandating that for preventive types of treatments and exams, you don't have to do any copays, because we want you to get that early diagnosis of any potential disease so your health will be much better, and eventually the cost of health care goes down because we catch diseases before they become acute. For small businesses, they pay today 18% more than do large companies for the health care of their employees, because they can't spread the risk in a larger pool of people. And so it costs more for them to go to a private insurance company than a large company. So we're going to permit them to spread the risk in what's called a health insurance exchange. There'll be many plans in there, but one of them will be a public health care option, where that plan does not have to pay the high fees, well, salaries really, for their CEOs and other employers, millions of dollars in salaries. And so eventually, with less administrative overhead, this plan begins to have the other plans reduce their cost in order to be competitive with this plan. I am a large proponent, as I said, because eventually, as we bring the uninsured, the 47 million uninsured in America, into a plan of their choice, we all pay less. Because presently, if you do have a health insurance plan, you pay about $400 more to cover the uninsured. Because when they go to an emergency room, the hospital passes the cost over to an insurance company that then passes it on to us who have private health insurance by getting them covered. And they're having preventive care. We eventually pay less. Thank you again for everything that you've done to support me. I promise you that every day I will work hard to win this seat. And I promise you, when I am the U.S. Senator from Pennsylvania, every day I will work for every Pennsylvanian. Thank you very much.